And welcome back to WNY News Now. As we have reported, the county has rolled out a new tool to help track the local COVID-19 pandemic in our area. Joining us live is Chautauqua County Executive P.J. Wendell to talk more about the new data tool. Executive Wendell, thanks for joining us today.
Thanks for having me.
So what can you tell us about this new online map and how does it work?
Well, the map is quite similar to one they're using in Erie County. When we discussed 2 days ago in our town hall meeting on Facebook, we did explain to everybody why we've switched the delivery method and the information we are giving out. The 8 counties of Western New York Public Health Alliance have all agreed to limit the location as far as towns of the residents. We live in a small community, and that recommendation came from NISAC. So we're following that to prevent that. We're looking for the safety of our residents too. There have been some threats made to small communities, so we want to make sure that our residents are safe. But the best part about this is you can go to chqgov.com, and then in the lower right corner, you'll see a red COVID-19 box. You click on that once, you'll then see another map of the county and our 4 battalions. 3 of them are red. Each of those battalions have had 1 confirmed case. 1 is not shaded. That has not seen a confirmed case yet. Click on that map, and then you'll get a more detailed map, quite similar to one that's used in Erie County. We've already used our 4 battalions. Most of our first responders, it's helping them too to know where the cases are inside of their firefighting battalions. They will be the first ones on the front line to respond to calls, so it's good for them to know as well. But also, it just gives our residents a general area of where those positive COVID cases are. If you click on the battalion that's shaded in the upper left-hand corner, it will give you the number of active cases, any cases that have recovered, and unfortunately, in the 1st battalion, we do have 1 fatality.
How did the idea come about? Who constructed this database and map?
The map, I believe, was constructed in Erie County, but Christine Schuyler in the Public Health Office did come up with our version of that map and how it was interactive. I know Bill Boria, one of our county employees, was very instrumental in putting the map up and drawing the boundaries through our GIS system as to each of the 4 battalions. Many other counties have used a system where they're dividing their county into quadrants. We felt after sitting down our COVID-19 team that we meet every morning, and John Griffith, our emergency services director, said, hey, let's look. We already have this done. Our county's divided into 4 battalions and almost intersecting the county in a manner that is very well distributed. So we thought that was a great idea. We took it and ran. And yesterday went online, and it's very, very simple. I demonstrated on my afternoon video that really it was simple and easy to access. And we hope that the residents use it and get the information they're looking for.
Now, what do officials hope to gain by having this data available not only to health professionals, but also the general public as well?
Well, I think most people want to be aware and concerned if there are cases in the community. If you look in the 3rd Battalion, for example, which is where I live, there are 4 cases that have been positive, and 2 of them have recovered. So it's good to know that we are on the mend, and people do recover quite well from the COVID-19 virus. And people just want to be in the know. We understand. We've said it before that COVID-19 is here. 4 of our cases that we have already expressed or actually have rolled out that they're tested positive. 4 of them have not had any travel history outside of Chautauqua County. So it leads back to the statement that coronavirus is here in Chautauqua County, and it is being spread throughout our community. So we urge everybody to be safe. Be very vigilant. If you are sick, we need you to stay home. It's not a matter of how tough you are, but it's really a matter of how safe you are and how willing you are to help your neighbors.
And I want to ask you about yesterday's update where county officials reported now of the 10 with COVID-19, 2 have completely recovered, as you mentioned. Do you know what their road to recovery looked like?
That I don't. Once those have come out, they county health department is in contact with the individuals, so they've expressed to us that they're on the road to recovery. One of the things that has eluded information is 98.2% of the cases are recovering. So that's a very positive number when we look. They will say, well, that's 1.8% that have a longer or more serious effect, but 98.2% recovery rate. So that's really good, and that's one of the statistics that needs to get out there. Our young people, anyone who comes down with this, one of our gentlemen that's recovered was in his 60s. So again, they are recovering well and following protocol, getting to your doctor when you feel that those symptoms are there, reaching out to your primary medical care doctor and getting in the system, I guess you would call it, and in the know for your physician, letting them treat you and give you the proper guidelines to move forward is really, really important.
And as for the other patients, what's the process like to monitor their situation? And if their condition begins to worsen, how would they get additional medical care?
Well, it's if they're at home and if they're on the quarantine, their simple directive is to call 911 if the situation gets worse. Obviously, informing your primary medical care doctor, your PMD, and giving them an update as to what your symptoms are and that they have worsened. Then you call 911. We have had for several weeks now, part of our dispatch, what they call PIDS, PIDS, possible infectious disease. So as the information is rolled out to our first responders, that is part of the dispatch information given, so that way our first responders are able to make sure they are properly protected as they go into those residents. Or if it's somebody who has not already tested positive, the symptoms through a quick triage on the phone is going to give the information to our first responders. It's a great system that's been working quite well. This goes out to, within the first week, there was a case I know of a fire department that responded. That designation of a PIDS call came out. The department took all the precautions, and it was very effective in mitigating any contact, and the result came out very well.
Now, the individual who passed away this week was an 80-year-old man who was being treated at an Erie hospital. Was his case considered to be severe, and did his age play a role in that? I know we've been talking about how the elderly generally are more susceptible.
Yeah, I don't have a lot of detail for that. I do know that he was uh, requested to go to Erie, which is very common. They do have intensivists. It has nothing to do nor a reflection on the capabilities of our three hospitals here in Chautauqua County. We work extensively with them. I know Amelia Lindquist Harley, the director of nursing at UPMC Chautauqua. Julie Morton, I've had a long friendship with her, working relationship. The ER director up in Brooks, and we're in constant contact with Westfield. So they are all very capable. In that situation, his doctor felt that he needed a higher level of care, and it's nothing different than we would do with somebody with, let's say, a heart attack or a stroke, that a higher level of care is needed, and they're sent to a different hospital. So that's what his doctor recommended. He was sent to Hammett Medical Center, and he received a higher level of care. I can't tell you exactly, but again, being 80 years old, that is one of the signs and one of the groups that is most vulnerable to this. So again, I don't have great detail, but that's all I can
Right.
say.
Right, but it just goes to show you the fact that those who are, as you've mentioned in previous reports, of the greatest generation that need to take those steps, and it's really not even them, but rather the younger people in the community who need to say, okay, I got to protect grandma and grandpa, I need to abide by this social distancing, and I know for me, I can say I haven't visited my grandmother in 2 weeks because she is in her home and contained.
Exactly. We're doing it myself. My mom's in her 70s, and I haven't been able to visit her. We talk regularly. Myself and my wife makes contact with her every day, making sure she's okay. But again, that's we do. We have to look out, and I've said it before. We need to take care of our heroes. Our heroes took care of us throughout our lives. We need to do it to them. It's our obligation, I believe, as the next generation, to make sure that they are taken care of. And like you said, Justin, it's as we're younger people, we seem to be invincible. That nothing is going to harm us, and it's not going to affect me the way it affects other people. Well, you got to realize that you can spread it to somebody else, and those are the people that aren't able to defend it as well as you are. So keep that in mind. And one of the things I do want to urge is everyone coming back to this area, be it residents who have lived in the South for this winter, as most of us do, snowbirds, anybody returning to Chautauqua County to call it home. We need to make sure that you quarantine yourself, stay in isolation. It's a precautionary measure. If you need any groceries, any supplies, please contact a relative or a neighbor. Ask if they can do that for you. But people returning home, it's really important that they help us help all of us in quarantining themselves, so that way they don't come down or they don't get sick with the coronavirus.
And I wanted to get your take while we have you about the new COVID testing site that was set up at Jones Memorial here in Jamestown. Officials at the hospital saying this is not a place where residents should go to get tested as an outpatient, but rather a referral from their doctor. As the leader of the county, seeing a site like this pop up, what's your reaction and take on it?
Well, they were in constant contact with us, the healthcare providers we meet with on a regular basis. They did inform us that they had the capability to increase the testing. And again, there's an algorithm that we have. There's a process. Again, a lot of recommendation from the New York State Department of Health as to who gets tested, how they get tested, et cetera. There is a referral process through local primary health physicians, and we are going to abide by that at this time to make sure that the supplies we do have are utilized effectively. Again, it's a great tool. We encourage the primary physicians that if their patients meet that algorithm to get them to the testing site. It goes to show we do have a great working relationship with our hospitals and healthcare providers here in the Chautauqua County area.
Now, speaking of great relationships, here in the county, we've seen several businesses now, all the way from Jamestown to Brockton, step up to offer their services with filling the need for PPE, that personalized protective gear. If a company's out there now who wants to help, what should they do?
Reach out to the CCIDA, Mark Geis, Rich Dixon, and their staff. We do have a list. We're compiling a list. It's getting bigger every day of local businesses that are willing to step up and answer the call, as I put it, from Governor Cuomo and his request for businesses to step up and make products, personal protective equipment, and the like that'll help combat this virus. The situation that arose with Jamestown Plastic, I believe, being in the EMS service now for 26 years, the True Hero face shield is really revolutionary. If you watch on television, as many people have, you'll see those pieces of plastic that hang over the face, and it is just that, a shield that comes down, where the new True Hero shield surrounds the face and keeps the droplets away. It's a much better protective area. It's reusable, very clear, very effective. It's made with medical grade plastic. It's just a really good product. So I've had it. I've used it myself. I've got a large head, and it fits me well. So again, it's comfortable, it's usable, and it's going to be a great tool. But I don't want to single them out. There's so many other companies. I know Jamestown Container helps make the boxes that ship the True Hero face shield, but also they're stepping up and making meal boxes and things of the like. So many companies I've heard in Chautauqua County, Artone, many Jamestown Container, Jamestown Plastic, and the like, really doing a great job. And I've said this before on another interview today, and I mean it from the bottom of my heart. I thank everyone who has stepped up to answer the call, whether it's a person who stayed home instead of going out and the person who felt sick and stayed home. Those are the people that I really thank from the bottom of my heart, not to mention our first responders, our healthcare workers that are on the front lines every day, our police officers, sheriff's deputies, and again, those manufacturers and businesses who have stepped up and answered the call. This is likened, or actually been referred to as the invisible war. And I would so proud that Chautauqua County has stepped up and answered the call, much like we did nearly 80 years ago when we answered the call for World War II. A lot of the same requests. Big companies are asked to switch from making cars to making ventilators. Other companies are asking to switch their operational systems to help combat this virus. And I am so proud that we in Chautauqua County have taken the lead in that effort.
All right, Chautauqua County Executive P.J. Wendell, we thank you so much for being on the program today, sir. And to let everyone else know, tomorrow your office is scheduled a press conference for 3 o'clock. We'll be streaming that live here as well. And if folks are concerned or have questions, should they reach out to the county? What's the best way to do that?
They could reach out to the county health department. They do have an answering system where they will direct the calls. If it's a call that needs to come to my office, the sheriff's office, IDA, or somebody along of the like, they will get that information to us. So they're really doing a phenomenal job. And I can't say enough about our county services that are here and again have stepped up. It's really been an around-the-clock effort for the last 2 weeks. March 15th, we issued the emergency declaration here in Chautauqua County, and we've been going nonstop ever since. So I appreciate all the efforts of everybody, my command team, especially our COVID-19 response team, but all county employees and all essential workers throughout Chautauqua County. Thank you for answering the call and helping your neighbors in a time of need.
All right, Chautauqua County Executive PJ Wilder joining us on the program. Sir, thank you so much for being here. We know you're busy, and we appreciate your time.
Thank you.